Silent heart attacks, often called the hidden killer, are a growing concern among young adults today, and what makes them especially dangerous is that they frequently occur without the classic warning signs most people associate with heart problems, such as severe chest pain or dramatic discomfort. Instead, these attacks creep in quietly, presenting with vague or mild symptoms that many dismiss as fatigue, stress, or indigestion, only to discover much later, sometimes during a routine checkup, or after serious damage has already been done, that they have had a cardiac event, and this trend is becoming alarmingly common in individuals in their 20s, 30s, and 40s, an age group traditionally thought to be safe from major heart disease. The root causes of this phenomenon are deeply tied to our modern lifestyles, beginning with chronic stress that drives up cortisol and adrenaline, hormones that keep the heart in a constant state of alert, raising blood pressure, heart rate, and inflammation, creating the perfect environment for arterial damage and plaque buildup. Add to that the widespread prevalence of poor dietary habits, the fast food, processed snacks, and sugar-laden drinks that dominate our meals and snacks, stripping our bodies of essential nutrients while loading them with unhealthy fats, salt, and added sugars that clog arteries and disrupt metabolic balance, and you have a ticking time bomb. Sedentary living compounds the problem, because prolonged sitting in front of screens not only slows circulation but also contributes to obesity, insulin resistance, and high cholesterol, three powerful drivers of cardiovascular disease. Silent heart attacks often strike in individuals who already have underlying risk factors such as undiagnosed hypertension, diabetes, or high cholesterol, which themselves produce no obvious symptoms until severe damage occurs. And when combined with habits like smoking, excessive alcohol, or reliance on stimulants like energy drinks, the strain on the heart becomes immense. What makes silent heart attacks particularly treacherous is their subtle presentation. Mild shortness of breath, unexplained fatigue, light chest discomfort, or even jaw and shoulder pain are often written off as stress or a bad posture day. But these can be early alarms from your heart that should never be ignored. Women, in particular, tend to experience even more atypical symptoms, such as nausea, dizziness, or unusual sweating, which leads to dangerous delays in diagnosis. Post-COVID inflammation has further amplified the risk, as viral damage to blood vessels and heart tissue increases vulnerability to silent ischemia and clot formation. The cumulative effect of these factors means that more young adults today are developing small blockages that quietly restrict blood flow to heart muscles, causing tiny scars that accumulate over time and increase the risk of sudden cardiac arrest later in life. The only way to combat this hidden threat is through awareness, regular screening, and lifestyle interventions. Know your numbers, including blood pressure, cholesterol, and blood sugar, and do not assume youth protects you from risk. Adopt heart-friendly habits such as 30 minutes of brisk walking or moderate exercise 5 times a week. Prioritize whole foods rich in fiber, antioxidants, and healthy fats like nuts and seeds. Cut down on refined carbs and sugary beverages, and stay hydrated. Equally important is managing stress. Through mindfulness, meditation, or even simple breathing exercises during work breaks, as well as ensuring 7 to 8 hours of quality sleep every night. If you ever experience unexplained fatigue, breathlessness, or discomfort in your chest, jaw, or left arm, especially after exertion, do not ignore it. Seek medical advice immediately, because early detection can prevent irreversible heart damage. Ask your doctor about non-invasive tests like an ECG, stress test, or cardiac CT scan if you have family history or multiple risk factors, as these can catch silent blockages before they turn into a full-blown attack. Remember, your heart does not give dramatic warnings every time. It often whispers, and by listening to these whispers today, you can prevent tragedy tomorrow. Silent heart attacks are not inevitable, but awareness and timely action are your best defense. So protect your heart now, because no career goal, deadline, or lifestyle convenience is worth sacrificing decades of healthy life ahead.